Nearly 1,800 nurses and hospital workers at Providence started a 5-day strike today, demanding a better contract. Union workers walked off the job and onto the picket line at 5:30 this morning in Portland and in Seaside.
KATU's Emily Gersh joins us from the Providence Portland Medical Center, where workers have been protesting for about 12 hours now. So what led to this point?
Yeah, Deb, well, if you take a look behind me, this crowd of people has only grown in spite of the rain. The workers I spoke with are asking for safer staffing ratios, for better wages and benefits. Now, this is the first healthcare workers union strike in Portland in 22 years. Early this morning, hundreds of nurses and hospital staff from Providence Portland, Seaside, and Home Health Care left work to demand better staffing, wages, and benefits. Workers in the Oregon Nurses Association say they've been chronically understaffed since the pandemic, with a patient-nurse to ratio as high as 6-to-1, when they say it should be a maximum of 4-to-1. They also say they're not being paid as competitively as workers in other hospital systems. They say their health care package is below standard, and many are using paid time off days due to benefits, including less sick time than in previous history.
We know it's possible for Providence to bring us up to the community standard, to match the other hospital systems as far as staffing and wages and productivity expectations. We know that that's possible, and Providence hasn't been willing to bargain on that.
In a press conference Monday morning, Providence leadership would not discuss ongoing bargaining, but said they support the workers' right to strike.
It's a decision for them in partnership with the Oregon Nurses Association. We have focused, as I think is appropriate, on ensuring that we can continue to provide safe patient care while our nurses take care of that business. And I feel very strongly that we've been able to do that.
Now at 5:30, these workers plan to march to Frazier Park, where union leaders will speak. But coming up at 6, hear more from Providence about how they've had to prepare for this week-long strike. They've had to hire hundreds of workers. We'll hear more from them at 6 o'clock.
Our nurses are overwhelmed with the numbers that they're trying to take care of now.
Hundreds of nurses and hospital staff at Providence Portland Medical Center, Providence Seaside Hospital, and Providence Home Health and Hospice Care walked off the job and onto the picket lines in protest of staffing, wages, and benefits.
KATU's Emily Gersh joins us from Providence Portland, where nurses have been picketing since 5:30 this morning. So, Emily, what do nurses tell you the staffing ratio has been like?
Yeah, Deb, well, we actually drove over here to Frazier Park, about a half a mile from Portland Providence Medical Center, where people marched here. I'll step out of the way and give you a shot of the crowd here. People are still trickling in for this as union leaders have taken the stage to begin rallying folks. They say chronic understaffing started during the pandemic and hasn't improved, leading them to this point.
We all became nurses to take good care of people, not just to take okay care of people. And so I feel for my fellow nurses that they probably do drive away from the hospital with a sense of failing their patients.
Linda Radcliffe has been a registered nurse in the Providence hospital system for 25 years. She says she joined the picket line in Portland this week to support her colleagues as they seek a safer staffing ratio, competitive wages, and improved benefits. She says nurses should only be given a maximum of 4 patients at a time to safely care for each one, a ratio she says surged during the pandemic and never recovered.
Well, I hear 6-to-1, 7-to-1 sometimes, and I know as a nurse that receives the patients from the floor and from the emergency room departments that these nurses are overburdened by trying to take care, basic nursing care of these patients.
Other Providence healthcare workers in the Oregon Nurses Association say their wages don't compare to other hospital systems, and neither do their benefits.
When a competitive rate of pay that will keep our talented nurses here instead of working elsewhere.
In a Monday morning press conference, leadership at Providence said due to the strike, Providence Portland Medical Center has had to reduce capacity by 25%, and Providence Seaside Hospital has had to reduce capacity by 50%. They've hired replacement workers from across the country, but they would not say how many or at what cost to the hospital system.
This is a challenging time for them, for our nurses, for our community, and for all of us. So it'll be important that as the strike concludes, that we come back to the table, are able to negotiate a fair contract, and really move into healing and reconciliation.
Now back out here live now, you can hear people cheering. They've got their signs up. This is just the first day of a week-long strike that they've planned. Both parties say they hope to come to an agreement when they return to the bargaining table. Live in Northeast Portland, Emily Gersh, KATU News.
Emily, thank you.